Everyone says exercise is good for you. But what if everything you thought you knew about lowering blood pressure was missing one crucial secret? What if I told you that just a few minutes of one simple type of exercise, done almost anywhere, could lower your blood pressure faster than running, cycling, or even intense workouts? Best for blood pressure, isometric exercises have emerged as one of the most effective ways to lower blood pressure, and recent research makes it clear why they deserve special attention, especially for older adults. While most people associate exercise with aerobic activities like walking, running, or cycling, or with high-intensity interval training, isometric exercises, sometimes called static contractions, work in a completely different way. These exercises involve contracting a muscle without changing its length, holding that tension for a set period of time, usually a couple of minutes. Examples include wall sits, leg extensions, and hand grips. What makes these exercises stand out is not just their simplicity or accessibility, but their remarkable impact on cardiovascular health, particularly in reducing both systolic and diastolic blood pressure. Multiple studies and meta-analyses have compared different exercise types and their effects on blood pressure. While aerobic exercises and high-intensity interval training provide general cardiovascular benefits, the reductions in blood pressure they produce are modest when compared to isometric training. In fact, some analyses show that the blood pressure lowering effects of isometric exercises can be almost double those of traditional aerobic exercise. This is significant because even modest reductions in blood pressure can dramatically reduce the risk of heart disease, stroke, and other related conditions. For older adults or those already dealing with hypertension, isometric exercises offer a safe, low-impact, and highly efficient way to achieve meaningful improvements. The underlying reason isometric exercises are so effective lies in how they influence the vascular system. When muscles contract during isometric exercises, they create temporary resistance to blood flow, which triggers the arteries to adapt over time. These adaptations improve vascular tone and reduce the overall stress on the heart. Additionally, isometric training helps strengthen muscles without placing excessive strain on joints, making it particularly suitable for seniors who may have limitations with more dynamic exercises. Another advantage is that isometric exercises can be tailored to individual fitness levels. The recommended approach involves using about 30 to 50% of maximal voluntary contraction. This means you do not need to push to your absolute limit, which minimizes risk while still providing substantial cardiovascular benefits. The exercises are held for 2 minutes per set, with short breaks in between and repeated several times a week. This simple structure makes it easy to integrate into daily life, even for those who may not have time or energy for traditional workouts. In essence, isometric exercises are a powerful, evidence-based tool for anyone looking to manage or lower their blood pressure, especially older adults who want a safe and effective method. By incorporating wall sits, hand grips, or leg extensions into a regular routine, people can see measurable improvements in blood pressure, gain muscle strength, and enhance overall cardiovascular health. Unlike other forms of exercise that require significant time, equipment, or space, isometric exercises are efficient, accessible, and sustainable, making them an ideal choice for promoting long-term health and vitality. Over time, this simple practice can have a profound impact, helping individuals stay healthier, more energetic, and better protected against cardiovascular risks. A quick and easy routine, the beauty of isometric exercises lies not only in their effectiveness, but also in how quick and easy they are to incorporate into a daily routine. Unlike many traditional forms of exercise that demand long hours at the gym, complex equipment, or high levels of stamina, isometric exercises are straightforward and efficient, making them particularly appealing for older adults or anyone looking to maintain health with limited time. A typical isometric exercise session can be completed in as little as 10 to 15 minutes, yet it offers measurable benefits for blood pressure, muscle strength, and overall cardiovascular health. This short duration is especially important because one of the main barriers to regular exercise is the perception that it takes too much time. By offering a routine that is both effective and time efficient, isometric exercises remove a significant hurdle that often prevents people from staying active consistently. The structure of these exercises is simple and easy to follow. Each session typically includes 4 sets of exercises such as wall sits, leg extensions, or hand grips, with each contraction held for about 2 minutes. Between sets, you take a brief 2 to 3 minute rest to recover. This setup allows individuals to work at a manageable intensity, around 30 to 50% of their maximum effort, without overexertion. The predictability and simplicity of the regimen make it less intimidating for beginners and older adults who may feel overwhelmed by more complex exercise programs. Because the exercises are static, there is no need to worry about coordination, speed, or balancing multiple movements simultaneously, which can often be challenging for seniors. Another advantage of this time-efficient routine is its flexibility. Since it does not require large equipment or a specific environment, you can perform these exercises almost anywhere, at home, in a small room, or even at work during breaks. A wall-for-wall sits, a chair for leg extensions, or a simple hand grip tool is all that is needed, making it easy to fit into daily life without disrupting other responsibilities. This convenience further enhances adherence to the program, as people are more likely to stick with exercises that are simple to perform and do not require extensive preparation. The short, concentrated nature of isometric exercises also offers mental benefits. Because sessions are brief, individuals are less likely to feel fatigued or demotivated, which is a common barrier with longer workouts. Completing a quick session can instill a sense of accomplishment and boost confidence, motivating people to continue exercising regularly. Over time, this consistent practice not only improves blood pressure and muscle tone, but also fosters a mindset of health, discipline, and self-care. In essence, the quick and easy routine of isometric exercises removes many of the common obstacles that prevent people from maintaining a regular fitness regimen. By combining effectiveness with efficiency, these exercises provide a practical solution for older adults and anyone looking to improve their health without committing hours every day. Just 10 to 15 minutes a few times a week can lead to meaningful results, making it an accessible, realistic, and sustainable approach to lifelong health and vitality. Proper technique. One of the most important aspects of getting the full benefits of isometric exercises is performing them with the correct technique. While these exercises are simple in structure, their effectiveness depends on following proper form, using the right intensity, and understanding how to pace the contractions and rests. Performing isometric exercises correctly ensures that you are targeting the intended muscles, reducing blood pressure effectively, and minimizing the risk of strain or injury. For older adults in particular, attention to technique is crucial because joints and muscles may be more susceptible to overuse or improper alignment. The first principle of proper technique is understanding the level of effort required. Studies consistently recommend using approximately 30 to 50% of your maximal voluntary contraction. This means you should contract the muscle firmly, but not to the point of complete exhaustion or pain. For example, when performing a hand grip exercise, you imagine squeezing as hard as you can to generate maximal force, then scale that down to roughly 1/3 to half of that intensity. Holding this controlled contraction allows the muscles to work efficiently without overstressing them. Using too little effort may not provide enough stimulus to lower blood pressure, while pushing too hard could lead to fatigue or strain. This middle ground ensures optimal results and safety. Another key factor is maintaining the correct posture and positioning during each exercise. Wall sits, Leg extensions and hand grips all require specific alignment to maximize benefits. For wall sits, your back should remain flat against the wall, feet shoulder width apart, and knees positioned above your ankles, not extending past your toes. Lowering yourself too far or positioning your knees incorrectly can place unnecessary stress on the joints and reduce the effectiveness of the exercise. Leg extensions require sitting with a flat back and lifting the legs until the knees are nearly straight, ensuring that the quadriceps muscles are fully engaged. Even hand grips require attention to posture. Sitting or standing with a straight back and relaxed shoulders helps prevent strain in other parts of the body, while focusing effort on the targeted muscles. Timing and pacing are equally important. Each contraction is typically held for 2 minutes, followed by a 2 to 3 minute rest. This structure allows the muscles and cardiovascular system to respond optimally while preventing excessive fatigue. The breaks between sets are not merely downtime, they are essential for recovery, helping maintain consistent intensity across all repetitions. Performing contractions too quickly or shortening rest periods can compromise effectiveness and reduce the blood pressure, lowering benefits of the routine. Finally, consistency in applying proper technique amplifies results over time. Even small deviations, like slouching during wall sits or gripping a hand tool too lightly, can reduce the effectiveness of the exercise. Paying close attention to posture, contraction strength, and pacing ensures that every session delivers maximum benefit. For older adults, mastering these details not only supports better blood pressure control, but also builds strength, stability, and confidence in movement, which are critical for overall health and mobility. In short, correct technique is the foundation of successful isometric exercise training. By focusing on the right intensity, maintaining proper alignment, pacing contractions and rests appropriately, and staying consistent, you can safely achieve significant reductions in blood pressure and improvements in muscle strength and stability. Proper execution transforms a simple, brief routine into a highly effective tool for health, energy, and longevity. Anywhere, anytime. One of the greatest advantages of isometric exercises is their incredible versatility, which allows them to be performed almost anywhere, at any time, without the need for elaborate equipment or a dedicated workout space. This accessibility makes them particularly appealing for older adults or anyone who may find traditional exercise routines intimidating or logistically challenging. Unlike going to a gym, attending a class, or trying to fit in a long jog or strength training session, isometric exercises can easily be integrated into daily life, making consistency and adherence far more achievable. This convenience is a key reason why these exercises are so effective in improving blood pressure and overall health, as regular practice is far more important than sporadic, intense efforts. The simplicity of the required setup contributes to this versatility. For wall sits, all that is needed is a wall and a small space where you can lean your back flat against it. Leg extensions only require a chair, which can be found in nearly every home or workplace. Hand grips can be performed using a light dumbbell, a massage ball, or even a rolled-up towel. This minimal equipment requirement removes barriers that often prevent people from starting or maintaining an exercise routine. There is no need for expensive machines, large spaces, or a strict schedule, which can make a huge difference for older adults or those managing other responsibilities. Another aspect of this versatility is the adaptability of intensity. Isometric exercises allow individuals to adjust the effort level based on their strength, stamina, and comfort. For example, the depth of a wall sit or the degree of muscle contraction during a hand grip can be modified to suit each person's ability, ensuring that the exercises remain safe and effective. This adaptability makes the exercises suitable for beginners, seniors, or anyone recovering from injury, while still providing measurable benefits for blood pressure and muscle strength. It also allows the routine to grow with you over time, gradually increasing intensity as strength and endurance improve, without requiring any additional equipment. The ability to perform these exercises anywhere also supports habit formation, which is critical for long-term health. Because sessions only take 10 to 15 minutes and can be done at home, in the office, or even while watching television, they can be seamlessly woven into daily routines. This reduces the mental barrier that often comes with longer, more complex workouts and increases the likelihood of sticking with the program consistently. Consistency is especially important for older adults, as regular practice over weeks and months leads to significant improvements in blood pressure, cardiovascular health, and overall vitality. Finally, this versatility enhances the psychological benefits of exercise. Knowing that you can complete a routine anytime without special preparation reduces stress and makes fitness feel more approachable and achievable. It builds confidence, reinforces positive habits, and encourages a mindset of proactive self-care. Over time, these small, consistent actions create a ripple effect, improving energy levels, mobility, and overall quality of life. In short, the adaptability and convenience of isometric exercises make them uniquely suited for anyone looking to maintain health, energy, and vitality. Their ability to be performed anywhere with minimal equipment and adjusted to individual ability ensures that maintaining a regular exercise routine is both realistic and sustainable, leading to lasting improvements in blood pressure, muscle strength, and overall well-being. Holistic wellness. The importance of a holistic approach to wellness cannot be overstated, especially for older adults who want to stay healthy, energetic, and youthful. While isometric exercises provide an outstanding method to lower blood pressure and strengthen muscles, combining them with other healthy habits creates a comprehensive strategy that supports overall vitality. Holistic wellness encompasses not just physical activity, but also nutrition, daily movement, sleep, hydration, and mindset. Each of these elements interacts with the others to enhance health outcomes, making it possible to maintain energy levels, prevent chronic illness, and feel more youthful in both body and mind. Nutrition plays a central role in this approach. A balanced, nutrient-rich diet fuels the body, supports muscle health, and contributes to cardiovascular well-being. Incorporating plenty of vegetables, fruits, lean proteins, whole grains, and healthy fats helps maintain stable blood sugar and cholesterol levels, while providing the vitamins and minerals essential for muscle function, bone strength, and overall energy. For older adults, paying attention to portion sizes and nutrient density is particularly important because metabolism naturally slows with age. Reducing processed foods, excess sodium, and added sugars can also complement the blood pressure, lowering effects of isometric exercises, creating a synergistic effect that promotes heart health. In addition to structured exercise, light daily activity is essential. Simple actions like walking around the neighborhood, stretching, or performing household chores keep muscles engaged and joints flexible, while also promoting circulation and mental alertness. These activities, when combined with brief, focused isometric exercises, create a layered approach to fitness that strengthens the body without placing excessive strain on it. For seniors, this combination can significantly improve mobility, balance, and overall confidence in movement, reducing the risk of falls and injuries. Sleep and recovery are equally crucial. Quality rest allows the body to repair muscles, regulate hormones, and maintain cardiovascular health. Poor sleep can elevate blood pressure, reduce energy, and impair cognitive function, making it harder to maintain a consistent exercise routine. Prioritizing a regular sleep schedule and creating a restful environment can dramatically enhance the benefits of both exercise and nutrition. Hydration should not be overlooked, as water supports nearly every bodily function, including muscle contraction, circulation, and toxin removal. Staying adequately hydrated helps optimize exercise performance and maintains mental clarity throughout the day. Even mild dehydration can lead to fatigue. headaches, and reduced alertness, which can undermine other wellness efforts. Finally, mindset plays a transformative role in holistic wellness. Maintaining a positive, proactive attitude towards health encourages consistency in exercise, nutrition, and daily routines. Practices such as mindfulness, meditation, or simply focusing on gratitude can reduce stress, improve sleep, and enhance overall well-being. A positive mindset also fosters resilience, making it easier to stay motivated even during challenging times or setbacks. By integrating isometric exercises with mindful nutrition, light daily movement, quality sleep, proper hydration, and a positive outlook, older adults can create a sustainable, effective wellness routine. This holistic approach not only supports blood pressure and cardiovascular health, but also boosts energy, preserves mobility, and nurtures a youthful sense of vitality. It demonstrates that health is not about one single practice, but about the consistent combination of habits that strengthen both body and mind over time.